Hello everyone, it's Dr. Awo. So today we're talking all things chemical peels. Chemical peels are one of the oldest skincare treatments, but I feel like they're also one of the most misunderstood. You've probably heard of names like glycolic acid peels, TCA peels, brightening peels, but what do they actually do and who are they right for? So in today's video, we'll break down how chemical peels work and what concerns they can actually help with, from aging to hyperpigmentation to acne, and how modern multi-acid formulas are changing results. Chemical peels can address 4 major categories of concerns: skin aging, with signs like lack of luminosity, fine lines, irregular texture, and loss of elasticity. Peels can help by improving texture, reducing superficial wrinkles, and enhancing luminosity. And then we have eye contour aging. So the eye contour shows aging first because the skin here is thinner, more vascular, constantly in motion, and it has a unique drainage. This requires specifically designed peels for the eye contour region, not just using a standard chemical peel in that area. So next is hyperpigmentation. Pigmentation can come from sun damage, hormonal factors, genetics, and inflammation. So peels can help reduce surface level hyperpigmentation, uneven tone and dullness, and mild photoaging. Next, we have oily and acne prone skin, which is what I have, with signs like excess oil, congestion, dilated pores, blemishes, and acne scars. Certain peels can help by having a keratolytic action on the skin, and this basically means it helps to exfoliate the clogged pores. Peels can help with their antimicrobial benefits, as well as reducing blackheads and whiteheads. They can also massively improve the appearance of scars. Let's talk about some of the ingredients you can expect to find in some chemical peels. AHAs, also known as alpha hydroxy acids. So this will help to stimulate cell regeneration and improve skin texture. I feel like this one doesn't get a lot of attention. That's PHAs, polyhydroxy acids. So these are gentler and great for dry or sensitive skin types. And then you have BHAs, beta hydroxy acids. These are really good for acne and clogged pores because they can really help to clear out the pores, and also they have antimicrobial benefits. Some peels might have TCA or retinoic acid precursors. And obviously the concentrations of peels vary and the concentrations of ingredients vary in each chemical peel. That's why you can have the superficial, medium, and deeper level peels. But we'll save that topic for another day. What results can be expected from a chemical peel? Luminous tone. You can expect to have progressive improvements with the course of treatments. Cumulative results for tone, texture, and hydration. So obviously depending on the depth and the strength of the peel, the results can be almost immediate, with the sensation of a smooth and radiant skin. And the improvement continues as the skin regenerates itself, which is why I think it's great for skin longevity and rejuvenation. Couple of things to note, however: chemical peels are not one treatment fixes all kind of treatments. And they are not always suitable during active skin sensitivity or certain medical conditions. Real results come from consistency and tailoring the formulations to the actual skin concern. So how do chemical peels fit into modern aesthetic clinics and treatments? So one thing is, peels are no longer seen as an isolated treatment. They're such a versatile tool that can complement other aesthetic procedures and enhance results. For example, you can have microneedling with a chemical peel, because when the skin is resurfaced and renewed, sometimes it just makes other treatments work that much better. But we have to build a tolerance if you've never done it before. So chemical peels remain one of the most effective and relevant non-invasive treatment in aesthetics because they combine science, controlled regeneration, and personalized formulation. When chosen correctly and performed professionally, they provide visible, predictable, and safe results. Thank you guys for watching. Comment down below if you have any questions, and I look forward to seeing you in the next video.